everybody, my name is Shannon Cushman and I'm one of the veterinary nurses here at the Ark Veterinary Hospital. With me today we've got little Louie who's coming in for a dental scale and polish. Now we've already done the health check on little Louie and all our vitals were normal, which was really good. And we did a very basic blood test which revealed that little Louie's BUN, which is a kidney enzyme called urea, was a little bit elevated. So we've just got to take precautions to make sure that the anesthetic is a little bit safer. It just means that we have to have him on fluids a little bit longer. We'll also monitor his blood pressure and change the drugs that we use. So I will see you in a little bit once we've done our scale and polish and we can show you exactly how we do it and what we do. And I'll see you in a flash. Okay, so we're back here with little Louie. We've popped a little catheter in him and we've given him oxygen for the last 5-10 minutes. And so we're just about to give him alfaxan, which is one of the drugs that we use to pop him under the anesthetic, and then we'll maintain him with a gas called isoflurane and obviously some oxygen. So we're just going to pop a tube down his trachea to make sure that we can have good supply to his lungs, and then I can show you the teeth and exactly what we do under the dental. Hello again, everybody. So I've got little Louie here under anesthetic. Basically what we've done is after we pop that tube in, we've hooked him up to the anesthetic machine, which is what delivers the oxygen and the isoflurane. And we've hooked him up to some fluids over here. We've got him on a fairly high fluid rate, just to help his little kidneys along, because we did have that elevated urea. And we'll keep him on fluids a little bit longer after the procedure as well. We've also got a little machine that monitors oxygen perfusion, which lets us know that oxygen is traveling well through the body. And we've got our Doppler machine here. That's that little sound that you can hear there. We use that as, number one, as a heart rate monitor, much like our SpO2 machine, but we will also use that to keep an eye on the blood pressure using a sphygmomanometer. So I'm just going to show you exactly what we've got here for little Louie. As you can see here, there's a little bit of tartar. You can just see along there and along this canine as well, and I'll just move this out the way. A little bit on that lower canine and on those lower premolars and molars. And this little red line you can see across here, that's called gingivitis, which is gum disease. That basically is caused by a buildup of bacteria underneath the gingival line. And I'll show you what we do now is before we start scaling and polishing, I'm just going to use this little tool here. It's called a probe. And as you can see, I hope you can see through the camera, it has tiny little measurements along here. And what we do is we measure along the gingival line, just like this. We just go under the gingival line and we measure how far that probe can go in. And we do that along all of the teeth. Luckily, there's no major gaps here for Louie, which is a good sign. Now, usually the gums do bleed a little bit. That's absolutely normal. Gums that tend to have a little bit more gingivitis will bleed a little bit more than others. But luckily, little Louie here has pretty good teeth. Just a little bit of tartar that we're going to take off. So what I'm going to do is I'm going to pop this throat swab in. This basically stops any collection of fluid going to the back of the throat, just to make sure we don't run the risk of aspiration pneumonia. We'll check this a couple of times during the procedure to make sure that we're not getting too wet. And we do like to swab the back of the throat once we're finished with the procedure, just to avoid, like I said, any aspiration pneumonia from any fluid going into the lungs. All right, and so I'll see you in a flash. I'm just going to pop this in, finish my probing, and then I'll do some scale and polishing. Okay, so we've scaled little Louie's teeth. As you can see here, there's quite a big difference. And we've made sure to scale on the inside of the teeth as well. And so what we're going to do now is we're just going to use, just like we have when we go to the dentist, we're just going to polish his teeth with our little polisher here. And using this paste, which is quite a grainy substance that helps just polish those and smooth those down nicely so we don't leave any rough surfaces for plaque and bacteria to build up on the surface of the tooth. So I'm just going to do that now, and I will see you again in a second. Okay everybody, so little Louis has woken up from his anesthetic, well, half waking up. The recovery time for the dental is quite an important period. It's not just the scaling and the polishing. We do have to keep an eye on their temperature during the recovery phase because obviously the face does get quite wet and there is quite a lot of loss of body temperature, so we've got to make sure that we keep them nice and warm and heated, and especially when we do go home, we've just got to make sure that all of our little fur babies have lots of blankets, no strenuous exercise, small amounts of soft food for a few days, and you can always come for a recheck in a few days if you'd like, just so we can have a look-see, see how we've recovered from the anesthetic. But there are things that you can look at home, apart from the obvious tartar buildup that we saw on little Louis and that gingivitis along the gum line. You may also notice things like inappetence, unwillingness to eat dry food, only wanting to eat soft food, chewing with one side of the mouth, pawing at the face, rubbing the face along the carpet, very bad breath. Luckily little Louis here wasn't too bad, bless him. But if you do notice any of those signs, the best thing to do is come down to the Ark Veterinary Clinic, make an appointment. The dental health checks are all free and they're done by either myself, Libby or Alex, one of our nurses. And we can get you booked in and do an estimate for you and give you lots of information on dental disease. It does affect 4 out of 5 animals. It's very common, and unless you're doing lots of teeth brushing and lots of dental things at home, it's almost unavoidable to come in for a dental health check and a scale and polish. It's always better to come in regularly for a quick scale and polish rather than come in when they're a little bit older and have long anesthetic times with extractions, because obviously the risk as they're a little bit older with long procedure, the anesthetic risk is a lot higher. So just take care, keep an eye, and when we're all recovered, we'll be good to go home, back to mommy and daddy, and we can stay at home and we'll go home with some nice dental food. This month is August, the dental month, so every dental that you do have with us, you get a free dental bag of food, as well as some vouchers if you ever do need to take some dental food back home with you. So just give us a shout if you've got any questions, and check our Facebook post for our little blog for more information on dental disease. Otherwise, you're more than welcome to ring us up on 9416-1300 and ask us any of your questions. Thanks so much.